Good morning, guys. How are you guys doing? Here again is Upstream Health with Ify. I hope everyone is doing okay today. So, quickly on this video, let's talk about cholesterol medications. Yeah, I know there's a huge controversy out there if you should be on your cholesterol medication, or maybe you're in that place where you're thinking, should I start this cholesterol medication? My cholesterol is high and my doctor is trying to put me on cholesterol medication. Oh, I don't want to go on it. Should I take it? A lot of fear about the side effects. Okay, guys, do I prescribe cholesterol medications for my patient? Yes, but remember, everyone is not the same. So before your doctor prescribes a cholesterol medication for you, they're going to look at other risk factors like your blood glucose level. Is it controlled? Blood pressure. Do you have uncontrolled blood pressure? Any history of heart attack or stroke or heart disease? So these are the things that your primary care provider is looking at. So number one question. So let's go straight to the question. Number one of this is, should I stop my cholesterol medication? So like I just answered this question, you shouldn't stop your cholesterol medication. Speak to your primary care provider and express your fears or your concerns. What's going on? Are you having any side effect? If you're having any side effect, of course you should stop it, but talk to your primary care provider before you stop it. Okay. And number two, can cholesterol medication cause dementia? So for this question, I'll say yes. So research is out there that dementia is actually associated with some cholesterol medication. So we have two groups of cholesterol medications. We have the lipophilic, which means it can dissolve in fat, and then we have the hydrophilic, which means it can dissolve in water. So if you're on cholesterol medication that is lipophilic, it means it can cross the brain, the blood-brain barrier to the brain. So that cholesterol medication can actually reduce your cognition, which means it associated with the risks of having dementia, especially if you or your loved one is already has a diagnosis of dementia. That can actually worsen dementia. So find out, you can speak to your primary care doctor what type of cholesterol that you have, and if you have any concern, you read something out there, do your own research and then speak to your primary care provider. Okay, yes, cholesterol medication has an association with dementia. Okay, and the reason is because your brain needs cholesterol. So if you're taking a cholesterol medication that is able to cross the blood-brain barrier into the brain, of course it's going to reduce cholesterol in your brain. Okay, and that can lead to dementia. And then number three is, can I take COQ10 while on cholesterol medication? So yeah, so cholesterol, one of the mechanisms of cholesterol medication is to reduce COQ10. So COQ10 is an antioxidant that you need for energy. So cholesterol medication actually reduces COQ10, and you actually need COQ10. So you can be on that supplement. But again, do speak to your primary care provider, because I know COQ10 has some drug interaction. Okay, like if you're on a blood thinner, so speak to your primary care provider. COQ10 is an over-the-counter supplement. It's actually a supplement. Yeah, I take the COQ10 also as a daily supplement. So that's it. And then number four, so can I take the same cholesterol medication as my mom? So can you take the same cholesterol as your mom? So I believe this question is asking if she can share medication with her mom. So no. All right, so before your primary care provider prescribes you a cholesterol medication, they're going to look at your medical history, right? So some cholesterol medications can actually interact with other medications you're taking. So I believe you have a different medical history or chronic condition with your mom, so you cannot share medications, not even any kind of medication. Okay, your doctor has to look at your allergy, your chronic medical condition, the other medications you're taking. And again, everyone is different, and everyone cannot tolerate the same medication the same. As I was saying, you cannot share medication, not even any medication. Okay, so your other medication that might be interacting with your with that same cholesterol medication that your mom is taking. And again, before your doctor puts you on a cholesterol medication, they're going to be checking your liver. Okay, if your liver is not in good condition, you cannot be on a cholesterol medication. Okay, they will have to make sure, because cholesterol medication can actually, one of the side effects, it's breaking down of your muscles, and then that can affect your liver function. So don't just pick up any medications and take or share because you feel that you have a high cholesterol. Okay, so I'm gonna end this video here. If you have more questions, you can send that to me through my Instagram, or you can actually ask it here, or for privacy you can do that through my Instagram page. Okay, and I'll see you in my next video. Actually, I'm gonna do a video on eggs, because I know also there's a huge controversy about eggs, if you can take eggs or meat or cheese, if you're trying to control your cholesterol. Okay, I'm gonna do a video on that also, and then I'm also gonna do a video on the list of food you can eat to have your cholesterol level under control, especially if you don't want to be on a cholesterol medication. Yes, you can do it. It has to do with discipline. Okay, so I'll see you in my next video. Bye bye and stay blessed.